Across the United States, we have hospitals, clinics, long-term care facilities, and more. You trust that when you arrive at these locations, you will meet professional, educated staff who will do everything they can to help you and those you love. The last thing you want when you take that unwanted trip to one of these facilities is for you or your loved one to walk in without an infection, but end up getting one inside the very place you set foot in to receive medical help. Unfortunately, that happens all too often, and it comes in the form of hospital-acquired infections, or HAIs. According to Jillian Zavodnik's article in the National Library of Medicine, hospital-acquired infections can cost an extra $10,000 and add to the length of stay and the mortality rate of our patients. By following evidence-based practice, healthcare professionals, to include myself, should review the evidence and push to reform policy that does not restrict the use of indwelling urinary catheters. So if your facility does not have anything in place that is restricting the use of your indwelling catheters, we should push to reform that. Okay? Let's start with some basic knowledge of what a UTI is, or urinary tract infection. Okay? It is an infection of the urinary system, very simply put. And it is inside your body. Your urinary system is sterile. So when we have to place in an indwelling catheter, we have to put something that is an object that is outside of that sterile field inside of it. Now, we may try to keep a sterile field, and we may do as many precautions as possible, but you are still adding that risk. Now, indwelling catheters are necessary. I'm not saying they're not necessary for certain conditions. For instance, if your patient has a chronic or acute case where they are having urinary retention, that's when they're unable to void their bladder for some whatever medical reason, and their bladder is just containing and then just keeps getting more and more and more fluid until it expands and bursts, then yes, an indwelling catheter is needed because there is no actual control and they can't void themselves. So indwelling catheter, make sure that they're able to do so, as well as with surgery. When a patient undergoes surgical procedures, they usually have an indwelling catheter in place to keep their bladder empty while the surgeon is messing around on the insides. But it can be limited. Now, as with most things in life, there is a time and place for them. We must try and seek out the evidence that suggests minimizing usage decreases infection. Like I've stated, we can minimize the usage, and when using an indwelling catheter, you should take it out as soon as possible. That is something that we can do if we do have to use an indwelling catheter to reduce the catheter-acquired urinary tract infections. According to Beeson, Pittman, and Davis's article in the National Library of Medicine, every day an indwelling catheter is left in place, it increases the risk of infection from 3 to 7%. That is extraordinary. That means after a few days, you're almost guaranteed to get a UTI. And with susceptible subgroups such as the elderly or the immunosuppressed, that can mean a lot when it comes to improving in the hospital setting if you have to fight off yet another infection. Now, we have some alternatives to indwelling catheters, and they are external catheters. Now, for men, it's not such a new thing. Okay, it's been around a little bit. And what that looks like in a man, it's basically a bag that goes over the male penis, and then it's hooked to intermittent suctioning. And what that does is take out the air and suctions it around the male penis. Now, this only works if the person is able to void. Okay, if they're incontinent or they're able to void on their own, this works. As I've said, if it's an indwelling catheter, you need an indwelling catheter when they're unable to void on their own. And as they void, the intermittent suctioning diverts the urine away from the patient. Now, with females, that's a bit of a new concept they have. Now, what they have, it looks like a hot dog with a rubber outing and an inside cloth. And what you do is you take that little hot dog and you spread the labia majora of the female and press the cloth section up against the end of the urinary tract, so that when she does void, it's absorbed in the cotton, and then it's hooked to intermittent suctioning. It does the same thing the male does. It diverts the urine away. Now, according to Beeson, Pittman, and Davis's article in the National Library of Medicine, Her experiment with the usage of female external catheters proved to divert 85.5% of urine away from the patient and decrease the catheter-acquired urinary tract infections rate from 3.14 per 1,000 to 1.42 per 1,000. And that's an over 50% difference, proving that when necessary, external catheters are a great replacement to indwelling catheters. Now, as a society, we are to push limits of what we know in order to give our children and their children a better, more prosperous future. That doesn't always mean that we have to identify a new element or send the first voyage to Mars. It can also mean improving on the smallest, most insignificant skills we have. By doing so, we can improve the length of stay, mortality rate, and hospital spending on very avoidable infections.